It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you, and I'm your host, Bob Roth, and it must be Friday. It is Friday, May the 4th, and we're coming at you live from the Scottsdale Air Park, Money Radio Studios, 1510 AM, 105.3 FM, and on the World Wide Web at moneyradio1510.com. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do we do this? We bring extraordinary guests to the show. And typically we talk about relevant topics that are thematic for the month, the issues that may be coming up. So this is one we kind of missed in the month of April, but we figured it's right here at the beginning of May, and I want to talk about alcoholism and seniors. And April was Alcohol Awareness Month, and I brought two extraordinary guests. As I say, guests make our show, and sitting here in the studio with me is Rich Crislip. He's the Director of Behavioral Health Integration for HomeCare Arizona, and I've got on the phone here with me, I've got Dr. Paul Boulware, and he's a psychiatrist over at St. Luke's Medical Center, where he's the medical director of the Generations Program. That is a geriatric inpatient psychiatry service. So welcome to the show, both of you guys.
Well, thank you for having me.
Thank you.
And Dr. Boulware, can I call you Paul?
Sure.
Perfect. So, we're talking about alcohol and seniors. And, there was a statistic that was brought out by the National Institute of Alcohol Abuse and Alcoholism that estimates about 80,000 of our country's nearly 8 million alcoholics are seniors. And older adults are hospitalized as often for alcohol-related problems as they are for heart attacks. I'm blown away by that. And I think, Rich, you gave me some of that information. You want to tell me a little more about that?
Yeah, it's it's the fastest growing healthcare problem in the United States, and it's one of the most commonly overlooked problems when it comes to our older adults. It's one of those things that is a lifestyle choice, and very often is something that is used throughout a lifetime. But nowadays, as we get older, it becomes more detrimental to our health as we drink and use alcohol.
And do you find that people were using it before, or are they using it more because, I know the stats, and I've shared this with our listening audience, about 1/3 of our older adult population, 65 and older, is living home alone. So are they depressed? Are they dealing with chronic illness? What do you see that as?
Well, it goes both ways. For a lot of people, they've been drinking as they've been drinking all their lives. They use it perhaps they're using wine during dinner or having some drinks after work or using it socially. And that was okay when they were in their 20s and 30s, 40s, 50s. But as we age, our body does not process or metabolize alcohol like it did when we were young. So it has an adverse impact on our health, mostly due oftentimes as we age, we are more susceptible to illness. We are often taking medications that do not mix well with alcohol. And then you also add, as you said, loneliness issues and loss. Loss is a common theme as we age, and for some folks, loss can be difficult to deal with. It can be depressing, it can create anxiety, and alcohol can be viewed as something that is an easy way to take the pain away.
Are you seeing the same thing, Paul, in your practice?
Absolutely. Yeah, seniors are very vulnerable. About 2/3 of seniors started drinking before they reached older age, so about 1/3 started in their elder years, and these are folks who many of these folks have mental illness, and the problem seems to be a lot of them are suffering from bereavement and dealing with depression and loneliness, and a lot of their friends are passing on, and so they look to alcohol to sort of cope with the loss. And it's a big problem. It's a very big problem.
And it sounds like it's continuing on. It's not something like that is decreasing. It's becoming more and more prevalent today. You're probably both seeing this in your respective practices.
Yeah, correct. It's the fastest growing health problem in the United States right now is alcohol.
Yeah, the baby boomers are aging.
Wow. And you know what? And it's interesting because we hear all about the opioids. And, you know, everyone's focusing on the opioids and they're attacking that. And obviously, now we're hearing about, medical marijuana and the legalization of marijuana. But, alcohol is something that has been in our society forever. And certainly I want to just piggyback on what you said, Rich, is that, you have to drink less of it. And, I'm a little bit more past the mid-age. I'm past the 50-yard line. And I got to tell you, 2 drinks, I'm done. I really am. And I don't really have any more than 2 drinks because I just can't really function after that.
Yeah, to your point, the opioid problem is something that we have to take seriously. But quite honestly, it pales in comparison to the problems that alcohol brings us. The numbers are significantly higher around hospitalizations due to alcohol abuse compared to that of opiates. I'm not saying opiates is not a problem. It's something we need to deal with for sure.
Sure.
But alcohol is by far the largest problem when it comes to substance use issues.
And certainly, Paul, you're seeing that in your practice, your psychiatry practice, especially in the Generations program. You're probably seeing a lot of alcohol issues that are bringing people to your program, right?
We do. We see a lot of alcohol issues and comorbid with other psychiatric conditions, patients with depression who are self-medicating with alcohol, and we see a lot of patients who have depression as a result of the alcohol. So, and we have to detox a lot of these patients who come in who are heavy drinkers, and a lot of these patients will underestimate how much they drink, and they'll go into withdrawal without telling us honestly how much they're drinking. And drinking more than 1 glass a day of one alcoholic beverage a day is considered a substance use alcohol use disorder in people, elderly people over 65. So there's a lot of it out there. The incidence is pretty high.
Well, I think it as well. I mean, when we look at older adults, they're taking a lot of medications. And
huge issue, yeah.
And you look at the prescription bottles, it says don't mix with alcohol, and the counterindications are you shouldn't be doing this with alcohol, and they're doing that.
Absolutely.
Yeah, I always like to say there's a difference between alcohol misuse and alcohol abuse, and those are the 2 factors that we need to look at with aging. As we age, we become more sensitive to alcohol. Our blood-brain barrier becomes more diffuse. Our tolerance for alcohol goes down. It impacts us. Our sensitivity is much higher to alcohol as we age. So just the aging factor puts us more at risk for alcohol. You add the illness and disease to that, chronic disease such as diabetes, congestive heart failure, COPD, osteoporosis. I can go on and on. And then you add it on top of that medications that people are taking very often as we get older.
Right.
All those things compiled together do create high-risk situations for adults that are older that may be drinking in ways that they think is safe and not necessarily in their minds abusing alcohol. They're just drinking like they have been for most of their life, but now it's a misuse issue simply because of those factors that I spoke about.
I liked how you categorize that, misuse versus abuse. And, one of the things that does come as a component of drinking and drinking excessively, whether it's 2, 3, 4 drinks, is the possibility of a fall. And we know what falls do. Falls are disastrous for seniors.
And I think a lot of this is overlooked because you think, oh, this is grandma. She's just having a couple of drinks. We don't have to worry about that. She's old. Just let her be. When this is a serious problem. Grandma can drink and fall and break a hip, and then she's hospitalized. She gets pneumonia, and that's it. So I think we need to not overlook and have this therapeutic nihilism about elderly alcohol use. So
certainly this first segment is a really good start to the conversation about the problem, because we do have a problem, and as you've indicated, Rich, it's not going away, and we need to bring this awareness. And I like the fact that we've designated April as our Awareness Month of this problem. But, I want to get into our second segment, which is coming up in just a few minutes here, and I want to talk about what are some of the solutions. How can we get out there to really identify and know the signs, and really how do we figure out a way so that we can prevent this from happening for these vulnerable adults out there. So as you can hear, the music is coming on, and we're down our first segment. Rich, it goes really fast, doesn't it?
It does indeed.
And how about you, Paul? We're down one. We got three more to go. We got 4 total segments. And we got Wes, our engineer, taking us out with a little Bruce Springsteen. We're down 1 segment. Stay tuned. We will be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're on segment number 2. And I have the fortune of having 2 extraordinary guests here in the studio with me. I've got, sitting right across from me, I've got Rich Crislip, and he is the Director of Behavioral Health Integration for HomeCare Arizona. And I've also got on the line with me Dr. Paul Boulware. He is a psychiatrist. He's the Director of the Generations Program over at St. Luke's Medical Center. And we are talking about alcohol awareness and our seniors. And we just came off the month of April. And the month of April, we really devoted a lot of time, and you, our listening audience, listened to 3 extraordinary shows that we talked about National Healthcare Decision Day. And I can't talk more about that, about making sure your wishes are known and you've selected an advocate. And like I said, if you miss those shows, go up to our website at cypresshomecare.com. Click on the media button. It's up on the top. 3rd button down is radio shows. You'll catch those 3 shows and about 200 others that we've been bringing to you for the last 5 years. So I'm going to get right back into this alcohol and seniors. And I will tell you, Rich and Paul, I didn't really think it was that big of a problem and that big of an issue. And when we talked in the first segment, we did address opioids. And opioids are an issue. And it's a relatively new issue, but alcoholism in seniors, I would imagine, has been an ongoing issue. And as we're aging, especially in Arizona, we have so many older adults. I think you're probably seeing more and more instances of it now.
Yeah, correct. Again, they figured about 20% of our older adults do have a drinking problem, and that we know with hospitalizations, medical hospitalizations, people actually going into a medical hospital, that the same amount for heart attacks is equal. People are being admitted for alcohol-related problems.
Wow. I mean, and when you mentioned that before about alcohol and heart attacks, I mean, we think of older adults, having heart issues, but, for me, I never think about, alcohol. And you, Rich, you mentioned the difference between misuse and abuse, and I would say that it's probably half and half. I mean, do you have a statistic in terms of where that is, in terms of alcohol-related hospitalizations? Is it misuse 50% and the other 50% abuse, or?
I don't have a specific statistic on that. That's a good question. But what I do see is that oftentimes people are not educated on the damage that alcohol can do to them as they age. So very often they may be admitted for breathing problems or falls, which is very common, not knowing that those 2 drinks that they had actually caused problems with their balance and led to the fall. So very often it's a lack of education on really understanding the danger of alcohol.
Right.
But then there's also that other group that has a long history of alcohol abuse and is carried on into their later years and have repeated medical and emotional problems related to that alcohol abuse.
And it's interesting. I want to tackle both of those. I know we talked about, knowing the science, and we'll get into that in a second, but you talk about the medical and emotional problems, and certainly every family deals with issues, but I got to imagine that emotional piece is big, and sometimes alcohol leads to, a lot of emotions and causes a lot of family strife and a lot of resentment and a lot of issues within families.
Yeah, there's always depression associated with heavy alcohol use. It is a depressant. It has the promise of euphoria. It has the promise of the healing touch. But in the end, it does more damage to your mood and does lead to much higher levels of depression.
Wow. And then on top of which, you shared in the first segment about worsening medical conditions such as diabetes and high blood pressure and CHF, which is congestive heart failure, or liver problems and osteoporosis.
Yeah, and there lies the big problem is that with our folks being admitted into hospitals for what they think is medical issues is really related to alcohol misuse or abuse.
Paul, would you want to chime in a little bit on this?
Oh, yeah. Well, with respect to mental illness, we see a huge percentage of mental illness patients, elderly mental illness patients, have alcohol use disorders. I think it's something like 35% of our inpatient population will have an alcohol use disorder. So it's a pretty big chunk of mentally ill elderly patients who have these disorders, and it's a hard thing to tackle when you're trying to treat someone's depression and they continue to drink. The medicines don't work as well in that setting, and compliance is a big issue. And if you can't get them to stop drinking, then the medicines don't really work, and the depression doesn't get better, and you're in this this cycle, this loop, and people don't get better. So it's very frustrating to treat patients who are heavy drinkers, and to move forward with their treatment. It's they do well in the hospital where there's no alcohol available, and then they go home and they go back to their usual alcohol use. And they relapse and they get depressed again. So it's tough to treat.
It's a vicious cycle, and it's interesting because one of the things that Rich brought up is sometimes when they show up in the ER, it's not really known that alcohol brought them there. Whether it be a fall or maybe a heightened issue relative to their blood sugar or whatever their challenge that they're dealing with. And,
absolutely.
Wow. So we've addressed this is an issue. And, I really want, the listening audience to really talk about, or share with our listening audience to really understand that this is an issue, but what signs should we be looking for from our older adults, our family members, our friends, our neighbors that might alert us that there could be an alcohol problem?
Yeah, one of the first things we have to know what is recommended use. And for anyone over age 65, for men, it's 1 to 2 drinks a day that's the highest amount that you're allowed. And for women, it's generally 1 drink a day. So if anyone's drinking more than that right there, that puts them at risk.
I want to stop 1 second. Can you repeat that one more time? Because I know that our listening audience is probably saying, really? Rich, one more time. I want to make sure everyone understands this. And you're saying 65 and older?
65 and older.
Okay, I'm 55, but okay. Repeat that one more time for our listening audience.
Yeah, so the Substance Abuse Mental Health Services Administration, the federal agency that oversees these programs, has recommendations for use. And for men over 65, the recommended at low-risk use is no more than 2 drinks a day. And for women, it's no more than 1 drink a day.
Well, that's some really good information for our listening audience to follow. And certainly me and everyone else that is a part of this show should adhere to, or at least with our older adults and our loved ones.
And consider that that's for people that do not necessarily have chronic disease issues, that are not necessarily taking medications that may have adverse effects related to alcohol. So for many of us who are over 65 that have other conditions, other health conditions, it's so important to talk to your doctor to say, should I be drinking at all? Are there problems related to alcohol with these conditions and these medications that I'm taking?
That's a great point. And, it's interesting, too, and for both you and Paul, we hear all the good things that are known about alcohol, and I'm talking about all the good things about wine, specifically red wine. You know, it's like you hear all the statistics that come out in the news, and they're saying, you know, chocolate and wine are okay. And it's like the Mediterranean diet, you know, you can have a glass of wine and olive oil. Okay. You know, but you forget about all the other stuff, right?
Right.
I can't believe music's coming on. Wes, are we almost done? Wow, we're at halftime here at Health Futures, and we're talking about alcoholism in seniors. Last month was National Alcohol Awareness Month, and we just started tackling knowing the signs, and I really want to, when we get back in our second half, I want to talk about those signs and what they are that we should be looking for. So you've been listening to Health Futures, Taking Stock in You. I'm, of course, your host, Bob Roth. I've got Rich Crislip here in the studio. He's the Director of Behavioral Health for HomeCare Arizona. And I've got on the line with me Dr. Paul Boulware. He is the director of the Generations Program. Dr. Boulware is a trained psychiatrist, and he's over at St. Luke's Medical Center. It's halftime here at Health Futures. Stay tuned. We'll be right back. Somebody else's house just to buy me a new
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we are in our third segment, and we are talking about seniors and alcoholism, and that this is a real problem. And we just came off the month of April, and it was Alcohol Awareness Month, and Rich has shared some really, really great facts with us, and one that I opened up the show with, and it came from the National Institute of Alcohol Abuse and Alcoholism, is there's an estimated 80,000 of our country's nearly 8 million alcoholics are seniors and older adults and are hospitalized as often for alcohol-related problems as they are for heart attacks. Unbelievable. Unbelievable, Rich. And while we were at our break, some of our guests that are in the studio asked this one question. I want to put it out on the air here for our listening audience. And if you missed the first segment and second segment, go up to our website at cypresshomecare.com, click on the media button, and hit the drop down. You'll get to radio shows, and you'll catch those first two segments. But one of the things that Rich was sharing with us in the second segment was the recommendation for older adults, 65 and older, are 1 glass of alcohol for a woman and 2 for a man, 65 and older. Did I get that right?
That's correct.
All right, so our guests that are in the studio said, well, if you don't drink 3 or 4 days in a row, can you stockpile them? And can you then catch up?
No, the answer is no to that. I'm sorry.
Okay, they're reaching for it, and, we're all trying to figure out, hey, look, it's something that we all know, and it's easily accessible, and I made the statement in the first segment, I know I can't drink quite what I used to. And I'm usually done at 2 drinks. I feel it in my body. And when I was in college, it was probably 8 drinks. So we metabolize it, and you brought that up before, very differently as we age.
Correct. Just growing older increases our risk for alcohol-related issues simply because of our age. And then you add health-related problems, medication issues. But there's one thing I really want to add too, is that this is not a moral issue. This is not a right or wrong issue. We're not saying that alcohol is bad. Alcohol is very much something that many of us enjoy. It's part of celebrations. It's part of relaxation. It's part of our social activities. So this is not a alcohol is bad type message. This is more about how to keep yourself healthy and safe, and understanding the risks of alcohol use as we age.
Paul, if you would like to expand on that, please.
On the effective
on that that it's not bad, and it's something that we just need to be using in moderation.
Yeah, absolutely. I mean, I think there's no place for judgment. I mean, patients who are depressed or who are drinking too much. It doesn't help to label them as bad or sinful or anything like that. They need help, and there's nothing wrong with them. That it's not a behavior that they want to do, and it's you can help these people out, and then there's nothing wrong with them morally, and they just need help. So.
Well, let's talk about how do we recognize the signs. What are we looking for from our loved ones, family members, people that are, friends, neighbors? What are some of the things that we should be looking for as it relates to possible abuse with alcohol?
Well, one of the things you really want to look for is there a change in behavior? Is there a change in mood? Is there an increased irritability, resentfulness? Is there lying or hiding behavior associated with their alcohol use? Oftentimes, with alcohol abuse and misuse, you have a change in appetite where there's just a loss of interest in food, a change in mood, as I said. So you really want to take a look at, are there changes in how they were before compared to now?
And, one of the things that, I think, and I brought it up in our second segment, is, certainly every family deals with challenges, emotional challenges. And I think that's one of the signs to be looking for. And certainly, having alcohol in a loved one that is dealing with some of those challenges only heightens it and only makes it worse.
Oh, most definitely.
Especially around the holidays. I can think of a former family member of mine that we all kind of stayed clear from during the holidays because this person would drink, and it's like, okay, we know to stay away from that person. and when I was younger, we had one of those people too, and my mother and father said, stay away from Daddy Chaz. Don't get near him.
Well, and also, too, I think for those of us who are, loved ones or family members, or even those of us who are providers or physicians or nurses caring for patients, is that we really need to have the courage to speak up on this. This is something that many physicians and family members are not comfortable talking about with our loved ones or patients. We view it as a privacy issue, or it's something that we're not, we just don't really want to invade their space around this issue, or just aren't comfortable talking about it. We fear it. And we really have to deal with that as a health community, as a family community, that this is something that we have to confront in a healthy, non-shaming way, in a helpful way, in a healthcare way, not in a shaming, moral way. Mm-hmm. But it's something that we have to have the courage to really begin to tackle.
No, thank you. And I would think, Paul, you probably agree with that.
Absolutely. Yeah, absolutely. Absolutely.
So just so you know, our guests here today work for, obviously entities that they're accountable to. And the gentleman that is directly in front of me is with Option Care Arizona. As I said at the opening show, he was the Director of Behavioral Health Integration. And I've been out to your website, and I got to tell you, very impressive. And you did a facelift to this thing. It's changed a little bit than it was before. I'm like, wait a second. I had, just recently Dr. Schnitzer in here, and we were on the website. So you're constantly enhancing this. And I would love for you, if you could, Rich, tell us or tell our listening audience a little bit about Option Care Arizona.
Optum Care? Yes.
I said Option. I meant Optum Care. Sorry about that. Optum Care Arizona. Thank you.
Yeah, Optum Care Arizona is a network of primary care physicians and specialty doctors and hospitals that provide Medicare-eligible patients with personalized and collaborative medical care.
And you have 3 centers here in the Valley, and they are community centers. And I know Dr. Schnitzer's talked about them. Can you share with our listening audience about those centers and what can somebody expect to receive or get from those centers?
Yeah, they're really my favorite part of being at Optum Care is that they are wonderful community centers located in 3 locations in Maricopa County, in North Phoenix, and in the Goodyear location out in West Phoenix, and also in the Chandler area. And they're wonderful community centers that they are equipped with exercise facilities and state-of-the-art fitness machines that are age appropriate and where people of all types of conditions and health situations can go in there and get a great exercise program. We have physical therapists and wellness directors that can assist you in developing great exercise programs that meet your needs and meet the issues that you may be dealing with. But alongside that, there are great social connection opportunities for people. One of the hardest things it is as we get older is that we deal with loneliness and isolation very, very often, and these are issues that are easily fixed with just having great centers for people to go and make friends and be part of a community, and those centers provide that. And then there's also we provide lots of educational opportunities. We have wonderful classes for our members that are free. And they can come in and learn about having healthier minds. I teach a Healthy Minds class that talks about how to decrease worry and deal with stressors and deal with loss issues and promote a much healthier mind. And we also have programs on sharpening up your memory and increasing your brain power. And
Dr. Paul Bentheim,
that's
Brain
it.
Savers.
Yeah. And we have dance classes, and we have all kinds of wonderful, fun activities going on there. So I encourage our members who are part of OptumCare to utilize that, and they're free.
They're free, and if you want to learn more, you want to call 866-339-3755 or go to OptumCare.com, and there's a drop-down arrow because OptumCare is in multiple states, and we're talking about Arizona. And you did say they were free, but I also know that if you are in the community and you live nearby one of those locations, you can go there and be a part of their programming.
Yes, another wonderful plus for these programs is that they're not just limited to OptumCare members. If you live by these centers, you are welcome, just as our OptumCare members are as well.
Awesome. Absolutely awesome. When we come back on our fourth segment, I'm going to have Paul talk about the Generations program over at St. Luke's and what they do. And I got to tell you, one of the things that you can do if you're listening in and you have a loved one that you are concerned about possible alcohol issues, as you said, loneliness brings it out. Get them over there. Have them participate in some of the activities, because we'll take and shake out that loneliness and make them part of that community. And if you want them to maybe talk to somebody about abuse and alcohol, they have the staff and they've got the people there that are qualified to work with them on that. So thank you very much, Rich, for walking through that. We're down our third segment, a little bit more Bruce to take us out here on Friday, May 4th. You're listening to Health Futures Taking Stock in You. We're talking about alcohol abuse within seniors. Stay tuned. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Good afternoon. This is Bob Roth, and you're listening to Health Futures, taking stock in you, and we're on our fourth segment. And if you're just tuning in, we're talking about alcohol abuse with our seniors. And we just came off of April, which was National Alcohol Awareness Month, and the statistics are daunting, absolutely daunting. The fact that we have an estimated 80,000 of our country's nearly 8 million alcoholics are seniors and older adults. And I think the statistic that came to us from the National Institute of Alcohol Abuse and Alcoholism, the NIAAA, is that older adults are hospitalized as often for alcohol-related problems as they are for heart attacks. And if you missed the first three segments, go up to our website at cypresshomecare.com, and you can catch the first three segments as well as about 200 others that we've been bringing to you for the last 5 years. But, one of the things that we talked about, and, my guest, Rich Crislip, brought up, who had to depart this fourth segment, but one of the things he brought up was that oftentimes it's, as much as it is abuse, it is misuse, and misuse, especially with all the medications that individuals are taking for their chronic or morbidity conditions that they're dealing with. And I still have on the line with me, I've got Paul Boulware. Dr. Boulware is a psychiatrist over at St. Luke's Medical Center, and he's the medical director for the Generations program. Paul, we've talked a lot about alcoholism. I want to talk a little bit about your Generations program, but is there anything more you would like to discuss as we wind down our program here in the fourth segment?
Sure, yeah. I mean, the Generations unit is a 36-bed inpatient psychiatry unit for patients who are over 55. So oftentimes we see depression, bipolar disorder, anxiety disorders, schizophrenia in these patients who are abusing alcohol. And treating the underlying disorder often helps the alcohol abuse. And then conversely, treating alcohol abuse makes it a lot easier to treat psychiatric conditions such as depression. I think depression is the big one that comes to mind because it's the most prevalent problem, and it's the most commonly comorbid condition with depression. And
the mere fact that we know a third of our seniors are living home alone, and that social isolation probably contributes a lot to that depression and alcoholism.
Oh, it's a huge problem. Yeah, and the spouse passes away, and the patient has no social support and no network of friends because they've all passed away, and they start drinking, and it really becomes a bad cycle.
It is incredible, and it's certainly the morbidity issues, especially diabetes, has got to make things even more complex because alcohol obviously is you're putting glucose and sugars into your body, and it only heightens blood sugar.
Oh, absolutely. The medical complications of alcohol use are a myriad of problems. Every organ in the body almost is affected by alcohol abuse. So medically there's a lot of problems here, and it's a daunting task to take care of all these patients.
So Rich Crislip was the one that brought up that it's recommended 65 and older, 1 glass of alcohol for a female and 2 for a male is recommended limits per day. I didn't hear you say that that's the limit. Do you subscribe to that? Because I'm sure a lot of people are listening. Come on, it's got to be at least a couple more, right?
Well, I think that that is the recommendation. I think that's great, but I don't think that's realistic. I don't think people do that. I think most, especially our patients. I mean, psychiatric patients, about 35% of them are substance abusers of some substance, marijuana, be it or opiates or alcohol. And the patients I see, 1 to 2 glasses of alcohol a night would be great, but it's just not realistic. We don't see that. That's very little alcohol intake, but it's a great goal. Really, this is a great goal.
So that is the goal. The goal is to get it to that point. So I do want to conclude our show and really talk about the Dr. to 4 Generations program for seniors at St. Luke's. I would love for you to talk a little bit about this. I had a chance to tour the inpatient unit, and I know you also have a Generations program that goes outside and you help people that just come in for like adult care, and then you transport them in and then take them back home. Can you talk to us about the program and what that is all about, and how did they contact you?
Yeah, we have a program called Momentum, which is an intensive outpatient program where you basically get picked up in the morning. They bring you to the hospital. It is an outpatient program, though. They bring you to the hospital, and there are groups throughout the day, and they are led by social workers and therapists. And then they feed you lunch, and then there are more sessions in the afternoon, and then they take you home after lunch. It's like being in a heavy therapy setting, but not having to stay the night like in the hospital. There is also a psychiatrist who supervises the program. So if you need to see the psychiatrist, he's there on site as well.
And
is it down from being in the hospital?
Is this a program? The Momentum program. Is this something that's privately paid for, or is this paid for by managed care and Medicare? How's that paid for? If you don't mind sharing.
Medicare will cover the Momentum program. Now, if you don't have Medicare, it really depends on your insurance. But most insurances will cover an IOP program such as this.
Fantastic. And that is a very innovative program, because not everybody needs to be inpatient, and they can get their treatment that way. And I think the thing that's fascinating about the Momentum program is that transportation is one of the biggest issues for our seniors today. So
huge issue, yeah.
So you will provide the transportation for them, so they don't have to worry about that.
Right, and there are two locations. There's one in Mesa, and there's one here down in downtown Phoenix.
No, perfect. And you want to talk about the Generations program?
Sure, absolutely. Generations. So there are 36 beds, inpatient beds, and most of the patients who are admitted here come in with either suicidal thoughts, or they are demented patients who come in with behavioral problems, and their nursing home or their assisted living facility will no longer tolerate their behavior. So they send them to us to sort of work on medication management for those patients to get their behavior under control and help them in any other way that they may need help. And I would say probably 50% of the patients that are here have major depression, and then a lot with anxiety disorders, and there's substance abuse is rampant of pills and drugs as well, but alcohol is a very big problem as well, and they don't really report it unless you really ask comprehensive questions, or they underreport their drinking, because it's not only is it a private thing, it's something that people are ashamed to talk about.
Right.
So they don't talk about the drinking problem if you don't specifically ask them, well, how much do you drink, and how often, and what do you like to drink, and when did you start drinking? And you got to ask a lot of questions, and people will start to open up the more questions you ask. The more that you seem interested in them and their drinking, the more they'll tell you, which is surprising when you really start asking people pointed questions about their use. You'll find that they'll open up and they'll tell you more and more about it, and it's very helpful.
Nice.
So we have nurses, we have occupational therapists, we have social workers, and sort of a collaborative team effort to treat these patients with mental illness and substance abuse disorders. So, good program.
And if they wanted to contact you, what's the best way for them to contact the St. Luke's Behavioral Health Center for either the Generations program or the Momentum program?
Right. So there's the number 602-251-8535.
And they can also go, and I'm looking at your website, they can go to stluke'sbehavioralhealth.org. And
yes,
your website's really easy to navigate through. And, as we wind down the show, typically, do you have an average stay for those that are in the Generations program? Are they in there for, typically, 14 days, 21 days?
Yep. That's exactly right. It's 14 days.
14 days.
Yep.
No, fantastic. We're getting ready to wrap up our show here, and I got to tell you, Paul, I really appreciate you being on, and I wish you could have been here in person, and I definitely want to bring you back because you guys are doing some phenomenal things here in our community. And, behavioral health is one of the biggest challenges that we're dealing with. And, I had the chance to have Justin Bayless on our show back in December, and I am very plugged in with Foundation for Senior Living and Jewish Family and Children's Services. And, we don't have enough resources, but one of the marquee resources around is St. Luke's and the work that you guys are doing. Matter of fact, I think it may be the oldest hospital we have here in Phoenix. Isn't that correct?
I think it is, yes.
Yeah, I think it is, too. I remember going down there and seeing pictures of the hospital and what it used to look like, and back then it was like a tuberculosis clinic, because back then tuberculosis was a really big issue for our state and the city of Phoenix.
Right.
Well, Paul, thank you for joining us today. You've been listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and we learned a lot about alcohol awareness with our older adults. Please be cognizant of it. Look for the signs. And if you need to learn any more information about this, feel free to reach me at Cypress HomeCare, 602-264-8009, or go out to our website, cypresshomecare.com. Make it a great day. Have a great weekend, and thank you for joining us today.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.